Hello, I'm Mabel Jong, and you're watching the World Healthcare Congress Interview Zone. I'm here now with Ms. Joy Pritts, who is the Chief Privacy Officer with HHS, and I'm so pleased that you had the time to join us today, Joy.
My pleasure.
You'll be talking about the sharing of health information and how to do that securely. There's been such a rush in getting electronic health records up and getting people to talk more about providing consistent care. But are we forgetting some of the security measures that should be in place?
Well, we're not. We are trying to stay on top of that. As you know, we're expanding the way that people share information and collect information dramatically. As it stands now, people get their care in isolation. They don't necessarily, none of the providers have a full view of the person's health or their health care. There's a lot of duplication in effort that way, and there's a lot of unwarranted costs with that too. Mm-hmm. So what HHS is trying to do is really to improve health for all Americans. We're doing this by encouraging the appropriate sharing of health information, the adoption of health information technology and interoperability, paying providers to keep people healthy instead of just to put them in the hospital. And also working with the HHS in particular is working with the White House on its initiative on big data and privacy. So we recognize that all of these new ways of collecting data, analyzing data, sharing data, all come with them some interesting aspects regarding privacy and security. Mm-hmm. So each effort that we undertake, we try to make sure that privacy and security is built in as we move forward. Okay. One example of that is in the Meaningful Use program, which is the Medicare and Medicaid Electronic Health Record Incentive Program. Mm-hmm. There is a requirement that providers use certified EHR technology. That technology has to be certified to have certain security elements in it. And the providers also, in order to get paid, have to attest that they've done things such as a security risk assessment. That's already required under HIPAA, but a lot of providers, unfortunately, are not aware of that and have not been doing that consistently over the years. So this requirement has really shown a really nice light on that requirement. And we're seeing an uptake now of people complying with that part of the security rule and actually looking at their systems, knowing where their health information is coming in, how they're using it, and evaluating whether they're protecting it enough. Okay.
So might we see the world look a little differently on that front in a few years compared to what it is now?
Oh, definitely. We're already beginning to see the impact of that requirement with the number of providers who are reporting having done a security risk assessment. Okay. Which is great. It's bringing people along. We also, in many of the requirements surrounding the Affordable Care Act, the regulations for the different ways of sharing information, almost all of those regulations have very distinct privacy and security components in them. They were built in up front to make sure that the information stays secure. Okay. Well, Joy, we thank you for the update, and we thank you for coming and presenting today. It's my pleasure. It's a topic that we love to talk about. Thank you very much. Okay. And I'm Mabel Jong. Thanks for watching.